My name is Dr. Kalangwa from Zambia, Ministry of Health. I'm Assistant Director in charge of Health Promotion and Community Health, and I'm happy to join the Health Accelerator program.
My name is Dr. Martha Stephen. I'm an Acting Director for Preventive and Promotive in Makueni County, as well as a Partner and Alliance Coordinator in the Department of Health.
My full name is Baron Songa. I'm coming from Zambia. My role in the Ministry of Health and in primary health care is that I do manage information and as monitoring and evaluation officer.
My name is Dr. Donald Mogoi. I work for the county government of Laikipia in Kenya as the County Director for Health. A County Director for Health is a technical advisor on health matters to the county governor and also to the county executive committee member for health. So it takes lead in technical matters around health, advising and also giving direction on any health matter that arises.
My name is Dr. Nelson Muril. I'm the County Director Health Services Nyeri. So my main role is I'm the technical advisor on all matters health in Nyeri County. So what I usually do is I coordinate health, I supervise and ensure that all the policies are implemented in the county government of Nyeri.
Why community health, why primary health care? We know that for us to be able to achieve universal health coverage, we need to reach the people where they are. And we believe that community health is the way to go because we'll be able to take the services as close to the people as possible. We know that in our mission statement for Ministry of Health, we want to take health services as close to the family as possible, and community health really becomes the avenue in terms of strengthening community health systems and driving the agenda of universal health coverage.
So the reason I wanted to get into this space for community health, one, it's we have focused a lot on curative components and rehabilitative, and not invested a lot in the preventive and promotive components. And literature has actually indicated $1 spent in curative, you're saving $8 that you'd have used in preventive. So that's why more efforts need to be within the preventive space. And our interest is to learn that a lot of this can be done through the community level, where we have the level 1 entry into the healthcare system in Kenya.
To me, that is the future. I always say that both illness and wellness starts at the household. So for a long time, the system has been biased towards curative. And the reason for that is because I always say that curative is emotive. That if, for instance, if you close the intensive care unit or if you don't have drugs in a hospital, that information, if it reaches the public, is going to cause a big outcry. But it's only now that the managers, the health practitioners, the providers, all the way from the community itself, they are starting to realize that we now need to gradually invest in primary health care, in community health services. So for me, as a manager and also as being part of an advisor on health matters where I come from, I believe that it could not have come at a better time in terms of the country investing towards primary health care. And what I like about it, there's a lot of political goodwill in terms of invest, because that is key. In all we do, I can tell you is that political goodwill is key, that if we have to ensure that UHC is implemented, as technical advisors, we can have all the knowledge, but if the politicians are not convinced, then we cannot achieve. But I feel that this time, from what we learned during the UHC implementation, we made a lot of recommendations in terms of policy reforms, and those have been done, especially in the current dispensation. So for me, I feel that policy we are covered, the political goodwill is there, we have the expertise, we have learned from the pilot phase, so we are ready to go and ensure that we know the benefits, that for every dollar that you invest, we know how much impact it has on the community and also on the health of the people.
This fellowship program really looks at how to strengthen our health system in comparison with other counties, so with other countries. So one was to learn from our counterparts from other countries, get to share experiences, get to share the challenges and how to overcome them, to also out of it get information and knowledge on how to tackle the various challenges that we face on a day-to-day basis as you're managing the 6 pillars of our health system.
The most exciting part of this program is that, first and foremost, it is equipping me it is giving me the skills, the tools to use. And that's what I would want to be changed into that urgent change as a champion of change.
First, I want to thank FAH for this opportunity to invite me into this boot camp as a facilitator. So I more or less came here to give the story of what we did during our pilot program that we did in Nyeri County in 2018-2019. We were piloting UHC as one of the 4 pilot counties in the country. So I feel that this is a perfect platform for me to share with the rest of the countries and the rest of the counties what were our experiences, especially now as the country gears towards implementing primary health care and specifically primary care networks.
My expectations for this fellowship program really is to understand the community health systems first and foremost, and also to understand the financing. I know that one of the critical elements is really financing of community health systems and also how to measure impact of the various programs that we implement.
In the next 10 months through this fellowship, my expectations is actually to get to learn a lot through the cross-exchange with my colleagues from other countries and also from other counties represented in this fellowship as well as to share our experience on how we have integrated community healthcare in Makueni County with them as well.